Welcome to Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and today we're going to dive into the transformative world of artificial intelligence and its profound impact on healthcare so far. As we explore this cutting-edge technology, we'll focus on kind of three key aspects or three large areas where I see artificial intelligence first making its impact. This will be very high level introduction, and then later on we'll dive deeper into some of these subjects as we move along. But as we explore this technology, I'll focus today a lot on diagnostics and treatment. We'll talk a little bit about patient care management and also some administrative views when it comes to how artificial intelligence is making its way into healthcare and how we should become more and more familiar with this and comfortable with its use. AI is fundamentally revolutionizing how we do our job as clinicians and how we provide healthcare. We look at AI making an impact, artificial intelligence making an impact in both diagnosis and treatment. The goal being offering increased accuracy and efficiency when it comes to healthcare. Some of these AI-powered systems are enhancing our ability to detect diseases early and with greater precision. There have been some failures in the past as well, but the thing about artificial intelligence and machine learning is that these systems learn from themselves. So you see kind of an exponential curve, and the program gets better as it moves along. So for example, you have some machine learning algorithms that can analyze vast amounts of medical imaging data and identify patterns that might be missed by the naked eye or from the eye of the clinician. So overall, when we look at these, and I remember early on in training when we started talking about precision medicine and what does that mean and so forth, artificial intelligence is adding a different layer to that with the goal that this will lead to more accurate, more timely diagnosis, especially in fields like radiology, where AI can detect these subtleties that can maybe be missed by the eye of the radiologist. So when you think of this, I like to use the term augmented intelligence because I don't think that artificial intelligence at this point should replace a radiologist or a pathologist that's looking at either radiological images, MRIs, X-rays, and so forth, or pathology slides. But it should be a way to aid the radiologist or pathologist to make a faster and more accurate read. And that is where I think the rubber meets the road with artificial intelligence, particularly from a diagnostic tool. We have a lot of data now in healthcare, especially with our electronic medical records. And so the goal is going to be, how do we use this vast amount of data and how can it be used to predict, for instance, outcomes or even, analytics and predicting things before it happens. So when you think about chronic diseases like diabetes or heart conditions, if we have stronger predictive models, they can help us as clinicians, as a healthcare team, figure out if there are interventions that can be done that can help lead to better long-term outcomes. So for instance, if you take something like diabetes, if you create an algorithm that looks at everything from your medications to some labs like your hemoglobin A1C to maybe some lifestyle things, and if you can put all that together and figure out some model that would predict when you might have some serious complication like a need for amputation or retinopathy, eye issues, or going blind, then as a healthcare team, I would get an alert that says, hey, based on this data that we're looking at, this patient is at high risk. So we need to intervene earlier with really bringing down the hemoglobin A1C. So that's the best way to think about how this machine learning and artificial intelligence can affect healthcare. Because as opposed to me sitting down and looking at your medication list and looking at your labs and looking at your history and looking at all these things and trying to put them together myself, I can generate an AI program that will take all of that information and give me some type of predictive value so I'll know how closely I need to watch that particular patient, and we can try to prevent some long-term complications from happening. So it's not a matter of if we're going to have AI in healthcare. It's already here. And whether you recognize it or not, artificial intelligence is already being used. And I think what we have to do over the next several years is figure out how to best harness this power in an ethical way in order to provide better health care. Now, we'll start by diving into what's called personalized treatment plans. And when I think of a personalized treatment plan, it's similar to what I mentioned earlier. So AI has tools that can analyze everything from genetics to treatment history and medication, lifestyle factors, and tailor this treatment plan to the patient. This makes healthcare more personalized, can lead to more efficient treatment and minimize side effects and greater compliance, because the treatment option that you've just outlined is more in line with that patient specific. And it's not based on just general knowledge that maybe you get from articles or studies and so forth. We can put in this patient-specific data or collect that data from electronic health records, medical records, history, maybe wearables, and you put all of that together with some program and figure out what's best for that patient. So that's a very powerful tool when it comes to AI. Another big area is drug discovery and development. Research is an area that has been faster to adopt artificial intelligence in the processes and put it to good use. The thing about AI, what gives us its advantage is that it can analyze vast amounts of data, more than the human can go through from reading medical journals and putting it all together. Artificial intelligence can analyze this vast amount of data and assemble it in a way that's most pertinent information for the physicians or the researchers, who could then take that more modified data and put it into practical use. The thought process is that AI can accelerate drug development, the process by predicting how different medications can react in the body. And if you can do this, you can reduce this trial and error factor when it comes to testing drugs significantly. So you'll reduce the time it takes for drugs to be developed, as well as the costs. So this could lead to faster development of life-saving medications. Could this ultimately lead to lower drug costs? Maybe so. We'll have to wait and see. But hopefully, if you can reduce this trial and error and trial and failure component of R&D, you can reduce costs. When you look at the cost of medications, that's one of the things they often point to, is that for every win, you have a lot of failures in molecules and drugs that didn't make it through the testing phase. So if you have a learning process or an artificial intelligence program that can maybe look at previous trials with a similar molecule or even previous work that you've done and put it together and give you a clearer roadmap, then that could help to save time and money when it comes to drug development. So the research piece has seen early adaptability in artificial intelligence, and we'll have to see exactly where that goes. Artificial intelligence is not only affecting or having an impact on the research and development part in developing new treatment. We're actually seeing AI applications when it comes to actually care management and how we're taking care of patients. It's not just changing how we diagnose and treat diseases, meaning research and development of new drugs and then diagnostic tools like with radiology and pathology, but how we actually manage the care of patients. The most common and the one that's most readily seen with this would be like AI-driven wearable technology. Wearable technology is enhancing what we call remote patient monitoring. I mean, I look down on my hands right now. I have a Apple Watch on one hand and a Oura Ring on my other hand. And with these devices, I track my sleep at night. I can do an EKG. I can look at my number of steps. I can look at my heart rate. All of these things, it's going on throughout the day through wearable devices that I actually have on right now and that I wear, every day. One of the problems that we have in healthcare is that when a patient comes in for a visit, we only get a glimpse. We get a small portion of that patient's life, an hour, 30 minutes. But there's so many other factors in a person's life that affects their healthcare, their environment. How close are they to a grocery store that has fresh, leafy green vegetables? How active are they? So these are all things that I wish I knew in between visits. But aside from just asking the patient, we don't know. And so this is where wearables or AI-generated remote monitoring comes into play. It will allow clinicians to kind of track patients' well-being continuously, and therefore you can respond more promptly when things start taking a downturn, and not just as they come in for visits or if they end up in the emergency room. This is particularly beneficial when you think about chronic conditions, and you can reduce hospital readmissions and ER visits if through some of these wearable devices, you can see maybe when a patient is taking a turn for the worse, and you can intervene earlier and circumvent or stop them from needing to go to the emergency room or the hospital. There are a lot of amazing things happening in this space. I recently took part of some training with MIT, and they're looking at things like invisible monitors or wearables that are in like boxes around the house where you don't even have to wear them. And through these devices, it can track your sleep, can track your movements and your gait around the house, your walking around the house. A lot of different applications and data that you can get from these devices and in certain conditions, like for instance, Parkinson's disease. If I can track your walking or your tremor, I can see how effective your medication is doing. And if I need to change the frequency of how you're getting it, or maybe the dosage. So that's some of the benefits that these wearable remote monitoring can do. Also, like, let's say, for instance, if a patient comes into the emergency room or is discharged from the hospital, you don't want that patient to end up back in the hospital or back in the emergency room again. So maybe if you could send them home with some type of a wearable device that can send you data on their temperature and blood pressure, heart rate, so that if they do start to take a turn for the worse, you can either intervene remotely or, have them come into the hospital before things get too bad. So wearable technology is getting better and better year after year. And it's a way in which we can really use and monitor how a patient is doing, and even looking at things like their environment, their activity, and it can help us as a medical community better take care of patients. The key is going to be, how do we package all this data in a way where it's useful and not too overbearing? Because you don't want to just collect a bunch of data on a patient and you have no way of using it, or it doesn't have any practical use to you. So that's going to be the key moving forward, is figuring out how to generate these algorithms and programs to best serve the patient and the medical community with information that's usable, that you can go in and intervene when needed. Another pretty cool application that I've been following is this notion of virtual health assistants, or these AI-powered chatbots and virtual health assistants that can provide kind of 24/7 monitoring and assistance to patients, and increase engagement and making sure that they adhere to treatment plans. These tools can answer some basic health questions. They can remind people about things like when it's time to take your medications, and can even schedule appointments. And I've seen tools like some AI-generated pill boxes. Some people have trouble remembering when to take their medication. So if you have some feedback, you can find out, you're supposed to be taking this 3 times a day, but it looks like most days you're only taking it twice a day. Or maybe you're forgetting that midday, noon dosage. So this application, as opposed to just setting an alarm on your watch, will be able to get the data that says, you didn't open your pill box, you didn't take your known medication, so go ahead and take it now. So this, I think, will help or enhance patient engagement, their adherence to treatment and medication plans. We're also seeing this a lot in the mental illness or mental health realm. There are not enough mental health counselors, doctors, providers than what we need. So here's an opportunity where AI is looking to step in and act as maybe a mental health coach. I've seen some programs that are incorporated into employee wellness plans where, if you're not having a good day or you're feeling bad, you can try to call, and maybe it may not be a live human that you can reach, but you reach some virtual chat box that can listen to you and listens to your concerns and provides some type of feedback. So this is again a growing area, but it's here, it's real, and it's an opportunity for us in an area where there's a lack of healthcare providers to maybe use technology, AI, to help from that standpoint. So it's another thing that I'm watching very closely, and it'd be interesting to see over the next several years how this field evolves and continues to shape our interactions with the healthcare community. Now, one of the key things with AI that it can do is look at patterns in a person's history. So by providing better care to the patient, there's this whole field called predictive analytics for preventative care. So an AI system can analyze a pattern of your history, looking at your current health risk data, and have some type of predictive capabilities that will enable healthcare providers and doctors to proactively provide that preventative care. And this too, I think, will will really help us out a lot with healthcare. It can reduce healthcare costs from patients going to the emergency room. If we can use this collective amount of data from the wearable devices, from your medication list, from your EHR, and create an algorithm with some type of predictive value that says, hey, you may need to watch this patient a little bit closer, or this patient's doing all the right things. Maybe you don't have to watch them as close. So that's one way which we're watching as well, that AI, artificial intelligence, can really help or enhance healthcare and possibly bring down or reduce healthcare costs. Now, the last big topic in AI that I like to discuss is healthcare administration. This is one of the ways in which AI I'm most excited about. Anything that can reduce burnout or cut back on the administrative tasks that we have to do would help so that we can focus more on patient care. So AI programs have started to streamline some of these administrative processes, which would allow the healthcare provider to focus more on patient care and taking care of the patient. AI is being used more to automate some mundane tasks such as data entry, claims process, appointment scheduling, all of these things that, you really, or we're seeing a reduced need for using a person and human error, which can cut back on some of these processes. So when you look at data entry or note taking, there are some pretty cool programs that help. It's called ambient programs, where it's just in the background listening to the visit and can take that visit and put it into a note format, taking out all the stuff you don't need and maybe putting together the stuff that helps with getting things approved, like orders or medications. And when it comes to things like appointment scheduling, looking at different changes in appointments and times, these are things where you don't have to spend time going in and do that if you have an AI program that will help you with appointment scheduling as well. So this not only improves the operational efficiency, but also it improves the overall patient experience by reducing wait times. You don't have to sit around wait on someone to call you back. And if these programs and algorithms are built out correctly, it can reduce administrative errors. So AI tools are already being used in doctors' offices and clinics when it comes to documentation. As I mentioned earlier, essentially serving as scribes to help us with doing our visit notes and making sure that the information that we need is in the note, and that is not a lot of extra fluff and stuff that's not needed. So this form of the use of AI in clinic, most people I think would welcome, especially when you talk about reducing administrative need for different things and a way in which AI can help clinicians to spend more time with the patient and less time doing some of these mundane administrative tasks. We're also seeing it when it comes to claims, making claims adjustments and denials, where using a program, it can look at data and say, okay, what's really needed in order for this to be approved, or why is this not approved a lot of times, and can help physicians to figure out whether there's enough information or we provided in the note the data that's needed to reduce the claims, which can lead to a delay in care for patients. So when it comes to these administrative usages of artificial intelligence, it's something that we can be excited about in the future and to see how these usages will impact patient care and clinic flow. Also within this administrative use of AI would be improving hospital efficiency. Hospitals are a big driver of increased healthcare dollars. There are a lot of inefficiencies, operational changes that need to go on in order to make hospitals work better and more efficiently. So artificial intelligence is being used to optimize some of these hospital operations. So about 50% of hospital admissions come from the emergency room, and 50% of hospital admissions are from elective surgery. So you come in for an elective surgery and maybe you have to stay a couple of days for the doctor to watch you or for you to heal and so forth. So if a hospital is using artificial intelligence, it can help to determine or look at things like length of stay or where you should go. Do you need to go to the intensive care unit or a step down unit or the regular floor? If you have a program that's looking at all this data, your vital signs, and collecting all that, maybe even before the doctor or a nurse can tell that a patient is deteriorating and maybe they need to go to ICU, maybe you get some alert from one of these systems that's looking at all of this data. So that is one way in which AI can help with hospital operations. It's not uncommon to be on the floor and your patient is taking a turn for the worse and you need an ICU bed, but there are no ICU beds because, there aren't that many ICU beds in a hospital. So if we can use artificial intelligence and algorithms that can maybe look at patients that maybe on the cusp, maybe they can be discharged from the ICU into a step down unit, and that way it frees up a bed. So that we can move in another patient that does need it. So looking at some of these artificial intelligence programs that increase hospital operations and efficiency are another way in which AI can help to reduce and cut costs. An example is Johns Hopkins. They partner with GE Healthcare, and they have this kind of command center approach where they use predictive AI techniques to improve patient operational flow. And this results in faster bed assignments for patients admitted from the emergency room. You can also use these tools to look at the operating room, how to make the operating rooms more efficient so that we know that 50% of patients come from operating rooms and procedures. So how do we use and stagger the times so that we can allow the hospital to run more efficiently. So these are all ways in which artificial intelligence can help with hospitals, and we're seeing some movement in this pathway, and some hospitals now are marketing and really touting themselves as being cutting edge when it comes to using artificial intelligence in some of these operational programs to really enhance the experience and making it overall more efficient and better for patients. So as you've heard, artificial intelligence tools are being used to streamline the revenue cycle, from insurance verification to claims processing and payment posting. All of these things can significantly reduce the administrative costs and improve cash flow for healthcare providers and for hospitals. So artificial intelligence tools are being used to streamline the revenue cycle, from insurance verification to claims processing and payment posting. So this can significantly reduce the administrative costs and improve cash flow for healthcare providers and for hospitals. So as we wrap up today's episode, it's clear that AI is not just the future of healthcare, it's already here. It's transforming how we diagnose, treat, as well as manage patients. We're a long way from going to your doctor's office and just talking into a screen and maybe a chatbot physician. But AI is quickly making its way into clinics, into doctor's offices in subtle ways in which you may not even be cognizant of or even recognize. But AI is quickly helping doctors to treat patients better. Now, there are challenges that we have to overcome, including some ethical considerations, like who owns the data? What do we do with genetic data? Different things like that. We need to look at the ethical implications of some of this and the vast amount of data that we have. And we need to create some type of robust regulatory framework around this. And we're seeing this in several states that are looking at the regulatory framework behind artificial intelligence and how we use it in healthcare. But the potential benefits of artificial intelligence in healthcare are pretty profound and immense. So I do think it's something that we need to continue to explore. But remember, as we navigate this AI-driven healthcare landscape, it's crucial that we look at the patient and put the patient first. So I would just remind everyone, increase your mindset, your health set, and your heart set as it pertains to your health and healthcare. Stay informed, ask questions, and be an active participant in your healthcare journey. So we'll continue to look at different AI applications and how those implications will affect your health moving forward. So thank you for tuning in to Your Health, Your Wealth. I'm Dr. Eddie Patton. I'll see you next time as we continue to explore the fascinating intersection of health and wealth in America. Please download this episode and subscribe to Your Health, Your Wealth, and share with others if you found this information helpful. Until next time, take care.